Hello, I'm Don Walker, and I'm Communications Director for Brevard County Emergency Management. And we're here today to provide you an update on COVID-19 and some other events that are going on in the county related to that and other subjects that we feel like are important to the members of our public. With me today, I have John Scott, who is the Interim Director of Brevard County Emergency Management. I also have Matt Wallace, who is the Public Safety Director. I have Maria Stahl, who's Administrator for the Florida Department of Health Brevard office. And I have Brevard County Fire Rescue Chief Mark Schillmeyer. I have this mask on because even though we're all here together at a big round table and we're social distance, we just feel it's important during this pandemic that we do everything we can to not only keep ourselves safe, but to keep those around us safe as well. So to kick this off, we've got Maria Stahl here today, and she's going to provide you an update from the Florida Department of Health on where the county stands as far as coronavirus. Maria, go ahead, please.
Hi, good morning. My name is Maria Stahl, and I am the Health Officer Administrator of the Florida Department of Health in Brevard County. To give everyone an update of our status as of this morning with our COVID-19 cases and positivity rate, we're at 2,985 cases, so we're very close to the 3,000 threshold. We had 175 positive cases report out this morning at 11.5% positivity rate. We are now at 26 deaths. That is an increase of 6 deaths in the last 24 hours. I wanted to give everyone a little bit of a comparison of where we are now compared to where we were 1 month ago. So on June 9th, we had 471 cases. So in 1 month, we've added 2,514 cases. We were at 13 deaths. We are now at 26. That's an increase of 13 deaths. Our labs were reporting out at that time at a 1.2% positivity rate. Overall, we were going about a 2% positivity rate. Currently, we're at 11.5, and overall, we're at a 5% positivity rate. Now, if I take that same data and compare it to just 1 week ago, which was July 2nd, we had 2,181 cases. So in 1 week, we've added 804 cases. We're at 17 deaths. We've added 9 deaths in the last week, and we were at 8% lab positivity rate. So the one thing I can say with our hospitals are, all of our systems are seeing an increase of patients going into the hospital. However, at this time, they are stable. They're taking preparations for what they need to do to increase capacity within their hospitals. And at this time, I want to assure everybody that there is capacity in our hospitals and they're all doing fine. As I say that, it's important that anyone does not go to the hospital to just get a test. Please go to the hospital when you're sick and you need to go to the hospital. And last thing, the few messages that I want to pass along is, if you're sick, please don't go to work. We are seeing a lot of positive cases amongst the 20 to 40-year-old population. That's the population that's out there working and intermingling with our more vulnerable population. So please don't go out and please don't go to work if you're sick. If you are elderly or vulnerable, please stay home as much as possible and just go out if you need to go out. Please wear masks when you're out in public places. Practice social distancing. Avoid crowds of more than 50 people. And lastly, wash your hands very frequently. Thank you.
Thank you, Maria. So as we continue to see an uptick in the number of COVID-19 cases in Brevard County, our commissioners are taking action to help protect the public. And Matt Wallace will tell you some recent action the commissioners took regarding PPE and small businesses. Matt, please go ahead.
Awesome. Thank you, Don. And again, I'm Matthew Wallace. I'm your Director of Public Safety for Brevard County. I'd like to thank you for tuning in with us this morning and joining us with this important talk. I do believe that education of everybody in Brevard County is one of the best ways that we will be able to overcome this threat. Without you knowing where we are and the protective actions that you can take and the recommendations that are given to you by CDC, Emergency Management, and the Health Department, that'll allow our citizens to make the most appropriate decisions you can for yourselves and your families and your loved ones, that we make sure that we can get through this together. We are a team, we are a partnership, and we believe in the citizens of Brevard County that you will do the right things at the right times for the right reasons. And I have no doubt that we will make it through this, and we'll make it through this together. So your county is absolutely being very proactive in the fight of what we're doing with COVID. I'd like just to highlight three things that recently we did as the county to get these things out. One, the county highly recommends, obviously, the use of face masks, both at home or not at home if you're social distance with your family and you have your family in you, but more importantly, if you're out in the community, if you're out at the grocery stores or you're out in any type of social situation, the county highly recommends that you wear a face mask protector covering. And again, this face mask covering, there's a lot of misconceptions about what a face mask does. It doesn't protect yourself, but it protects others from getting the virus from you. So if we can protect our fellow citizens and protect our friends and our family, we must use every opportunity that we can. So the county absolutely highly recommends the use of a mask. The county also is recommending to businesses to hang signage at your locations if you require a mask or if you don't. So your patrons will know up front, firsthand, what county businesses will require face masks. We will help that out here in our second point. The county has set aside dollars and funds to provide PPE or protective personal equipment gear for all small businesses in Brevard County. We are in the initial stages of rolling that plan out, but we have about $500,000 set aside to roll out these PPE kits. We're going to be targeting small businesses in Brevard County that have 25 employees or less. Again, stay tuned with brevardcounty.gov online and all the media posts that we have on how your businesses may want to enroll in this program and receive that PPE gear. We hope to be rolling that out by the end of the month is our goal, but again, stick with us and more information to come. Also, the county recently set aside $10 million for small businesses to help combat the loss of revenue in your small businesses in Brevard County. We are in the initial stages of rolling that program out as well, but again, like the PPE gear, we're going to be targeting small businesses of 25 or less that work out of Brevard County, local businesses, so we can invest back into our communities and help our own. As part of the PPE equipment that we're rolling out, we will be including signages for businesses so you don't have to go out and print your own signs. We'll make sure we take care of you there too if you want to be part of that PPE program. All of these programs are an emphasis to make Brevard County citizens safer, to combat this disease, and to get us to a better place where we can get back to a little bit of normalcy. So please continue to tune into us for the latest and greatest and things that we're doing to make sure that we serve the citizens of Brevard County to the absolute best of our abilities. And I know everybody in county government has that as our goal from the top down to the bottom. It is about the citizens that we serve. It's about the people that we need to make sure that we take care of. So please continue to be with us. Please continue to hang out with us. Please continue to attend and tune in to these events that we have where we try to get out the most recent information possible. I'd like to turn it back over to Don. So thank you, sir, and let's continue on here.
All right, thank you, Matt. So while the county does not have a mandatory mask policy in place, we do have a very active social media campaign where we are recognizing our residents who are wearing masks. We call it the Mask Crusaders campaign. It's a social media campaign. It's been very lucrative as far as the number of residents who have taken part in that and sent us pictures of them wearing masks. We simply want to know, are you wearing a mask? And if you do, why? And we've gotten great response and feedback on that. We're getting as many as 300 comments on our posts daily. That program ends today effectively at 5 o'clock, so we will not be accepting any more photos. However, we have enough of those in place that we will continue that campaign through the end of August. So we greatly appreciate all of your assistance with that. We commend you for wearing a mask because we know you're doing it not for your own self but for others around you, and that's very important. And again, just thank you very much for taking part in that campaign. It's been a huge success. With that in mind also, as you may be aware, hurricane season began June 1st. It runs until the end of November. We're just starting to enter that active part of the year where we do start seeing more of those storm events being created in the Atlantic. And John Scott with Emergency Management is here to give you a little bit of an update on hurricane season. John?
Thanks, Don. My name is John Scott. I'm the interim director for the emergency management for the county. I just want to touch on a couple of the adjustments we continue to work on following or with Corona and hurricane season. As Don mentioned, we are well into hurricane season, and we've seen an active season so far. We've already had 5 storms, so it's important that we're all taking this very seriously. We want to remind folks that hurricanes don't care if there's a pandemic or not. So it's still important that we're all taking the necessary steps that we would in a non-COVID year to be ready for a storm. We're doing that at the county level. We continue to work through our shelter planning to make sure that we're providing the kind of adjustments that can keep our residents as safe as possible when they need to be as safe as possible during scary situations. So we continue to work on making sure we have appropriate PPE. We will have masks for everyone in the shelters, both clients and staff. We will be doing temperature checks. We're working with our school and county partners to make sure that we're able to social distance at each one of those shelters, so that we are doing our very best to comply with CDC and health department guidelines. We are also working on the idea that we're going to have to open more shelters than we would traditionally, because we're going to sort of work to accommodate that social distancing. So we're going through and making sure every one of the shelters has all the supplies and kits they need, and we're really trying to make sure we're dotting all the I's and crossing all the T's. From the emergency planning side, we're also making sure that we've got stuff in place to set those kinds of things up. This year it's going to be a little bit more laborious to set a lot of our protective actions up. So we're making sure we're planning in advance and setting up enough time or enough lead time so that we can accomplish all of those things we need to accomplish. And those are sort of where we're very focused right now with our emergency management partners. I do want to come back to the idea that, for residents, we need to make sure that we are preparing appropriately. We know that preparedness is the key for our success in any one of these events. So we want to make sure that in addition to your regular disaster supply kits, where you've got hygiene items, you've got food, water, any medicine, that you're also adding things for COVID. So you're adding hand sanitizer, you're adding soap, you're including a face covering. These things make differences. We want to make sure that everyone is being prepared because, like I said, hurricanes don't care if there's a pandemic. Folks still live in vulnerable locations and structures. We're still going to need to evacuate from those areas and seek safe shelter. So that's what we remain laser focused on here at the EOC. Don, back to you.
So as part of our COVID-19 response, our frontline responders, first responders, are on the front line. That's what I'm trying to say. We have Chief Mark Schulmeyer with Brevard County Fire Rescue here today to give you an update on fire rescue actions. Mark, go ahead.
Thank you, Don. Once again, Mark Schulmeyer, Fire Chief with Brevard County Fire Rescue. And so as Maria was talking about earlier, we have seen an uptick in COVID-positive patients being tested, and so that trickles down to us as frontline workers. Brevard County Fire Rescue is a county-wide transport agency, so we have seen, as a result of the increase in testing in positive patients, we have seen an uptick in the amount of patients we are transporting a day that are COVID-positive or COVID-related patients, to the tune of about 20 to 24 COVID patients per day transported by us. Our decontamination teams are working around the clock to sanitize those ambulances, keep our crew safe, keep our public safe, and get those ambulances back in service so they can run more calls. And so they're doing a fantastic job. We have 2 of those teams in place, one in the north end of the county, one in the south end of the county, and they are literally busy all day long. So they're doing their job to keep us safe each and every day. We talked a little bit about masks. Masks and other PPE are crucial for our operation. We are following the county manager's directive. Our folks are wearing face masks in the stations and out in public, so you'll see them masked up as well. Also, our fire stations are still closed to the public for tours, but they are open for the Sharps box exchanges and for walk-in medical calls, obviously. The message we keep reiterating to our folks is the same message that we keep reiterating to the public, and that is wear your proper PPE, socially distance when possible. Our folks need to wash their hands, practice proper hygiene. We are wiping down and disinfecting equipment on a regular basis. And once again, what Maria had said, we reiterate to our people, if you are sick, please don't come to work. And so that's what we're trying to get out. The Mass Crusader program is wonderful. Wearing the proper PPE, like Matt Wallace said, might not protect you, but protects the public from you. So that's it. Thank you.
So as part of our program today, we have our social media specialist, Jessie Ray, who's been monitoring Facebook, and she has been looking for any questions that our viewers may have posed. And Jessie, I'll turn it over to you to ask any questions.
Sure. Thanks, Don. So Maria, we're going to come back over to you really quick. We had one person who maybe just wanted a little bit more information on how are we tracking recovery data and active case data? Can you give us a little more information on that?
Yeah, I will talk a little on the recovery data. The state is not publishing recovery data. The reason is there's several different ways of capturing recovery data. And the state there's just no consistent way to actually document the recovery data. So that is not being submitted. Primarily, you are recovered in one of two ways. There's a test-based strategy and there's a non-test-based strategy. The test-based strategy would be 2 negative tests 24 hours apart. The problem with the test-based strategy is you can have dead virus that still shows up as a positive test, and that can show up for 2 months. So the other way is the non-test-based strategy, which is 3 days after your symptoms, or I shouldn't say symptoms, temperature. 3 days after your temperature has resolved without taking any medication, and 10 days from the start of your symptoms. So that is totally appropriate to say you can go back to work when you reach that point. And I'm sorry, what was your other part of your question?
Active case data. Is there?
The active case data, all labs that are positive are reported through each lab into our state system. It's called Merlin, our state Merlin system. And that's where all the tracking happens from that point. That's where our epidemiologists and our contact tracers get their information to know who is a positive and who is a negative.
So speaking of contact tracing, we went over this during our last live a little bit, but I was wondering if you could talk about the contact tracing efforts that are happening in Brevard County.
Sure. The contact tracing efforts, contact tracing is only as good as the person who's the case is willing to give you the information for. But every single case, we attempt to contact them. We probably are contacting 80 to 85%, and that's not due to lack of effort. The other 15% don't want to be contacted. We contact each person. We find out their close contacts. We give them information for their household contacts. We tell them to follow up with their close contacts and also their place of employment. If their place of employment needs information, we definitely then work with them. And I can also state with our uptick of cases, we were managing it with about nine staff within our epidemiology department. With our uptick of cases, it became a little more challenging, and we do have contract staff that was sent to us from the state. So currently, we have about 60 individuals that are not just doing contact tracing, but helping out in other efforts. But we have about 60 additional staff right now.
Okay, thank you so much. John, over to you for just a moment. So they're wondering what steps are we kind of considering for social distancing and safety when it comes to the shelters?
Sure. So I can talk a little about how we're going to approach social distancing in the shelters. Traditionally in our shelters, we don't necessarily designate specific spaces for people. We're going to be looking at ways to do that for this season. So that may mean that a family gets a specific area that's maybe taped off or identified on a larger sheet somewhere that corresponds to sort of a larger map. We're still working through some of those techniques. Families will be grouped together. Groups who come to the shelter will be grouped together. And then also, one of the things that's real important is walkways and space in between. So we're going to be making sure that in those groups, as you sort of go to the next group, there's going to be some space, that sort of 6-foot distance that exists there. So shelters can be a little bit tight. That's why we're going to open more than we traditionally would for whatever the threat is, so that we can accomplish those kinds of things. Some other options we're looking at is, are there, when folks come in, is there a specific way to sort of say, we're going to put 10 people in a classroom and limit some classrooms. So we're working through all of that right now. It's a very new process that all of us across the state are trying to figure out, and we're pulling from those best practices and sharing with other counties so that we can all sort of find the best way to achieve that goal.
Yeah. John, I should add that we are encouraging people as they prepare for hurricane season to factor in sheltering as they put their kits together, PPE equipment, face masks, hand sanitizers, just like you would bottled water and non-perishable foods. Factor in the PPE as you prepare for hurricane season, and also even more so, and I want to ask you this question, John. There's a different mindset on evacuations this time, where some people might evacuate just because they see their neighbors evacuating. You might not really need to go to a shelter, and you might really want to think about that more on the front end, especially with the pandemic in mind, whether you actually need to go to a shelter or what you need to do if a hurricane shows up, in the cone of uncertainty for Brevard County.
Yeah, Don, you're exactly right. Historically, we've seen folks who should evacuate who don't, and we see folks who maybe that don't need to evacuate that do. And in general, we're pro-evacuation for anyone who doesn't feel safe. But this year, given the impacts of COVID and some consequences that come from it, if you're someone who lives in an area that's not a storm surge zone, that's not a flood-prone zone, that's not an area, you don't live in a structure where you're talking about you're susceptible to high winds, so you don't live in a mobile or manufactured home. So basically you live in sort of the center or the west part of the county and you're not in a flood zone, you're safe from storm surge, you live in a good strong structure, something that's been built to newer building code. So something from 94 on, or especially 2002 on, and you've got window protection. You're safe in your home and you can stay there and ride out the storm. You don't necessarily have to evacuate. And that's something that we're going to continue to message this year, is really look hard at your evacuations and whether or not you need to go. If you live beachside, you absolutely need to go. If you live in a mobile or manufactured home, you absolutely need to go. If you're in somewhere where you've had floods in the past, you absolutely need to go. But again, if you're in a good, strong structure in one of those areas where you don't see that same sort of threat, and you've gotten a hardened home, you've taken steps to put shutters up or plywood, you're pretty safe there.
Okay. So Don, I'm going to put you on the spot here just a little bit. We have a lot of people asking questions about schools and how that's working, and I know we've discussed this before, that that's more questions for the school board, but I just wanted to give you the opportunity to maybe touch on that a little bit to address these concerns.
Well, the only thing I can actually say about schools is I know the governor has said that he wants schools to reopen come August for the fall. And, while we don't really speak for the school system, there's an old saying, stay in your lane. So I would really defer those questions to the school system. But I think, that ultimately, and even Maria, you might have something to add to this from an FDOH standpoint, doesn't that ultimately boil down to FDOH and whether they think the schools are safe to open, or whether parents individually think it's safe to put their kids back in school?
Well, right now, the education commissioner and the governor and the president all said schools are going to open. What I can say is you're absolutely right. It is the school district in consultation with us. We do have staff that are sitting, assisting them, with their plans and giving them the guidance based on CDC and DOH guidance.
I'd also like that, if I'm not mistaken, the school board had a meeting this morning that they were discussing opening up plans. So I'm sure they were streaming it live. If you could maybe go out and do a little bit of research. They talked about that, I know, this morning at, I believe, 9 or 10 o'clock.
Yes, it was at 9 because we have a staff member there,
Yep.
yes.
And I would also just, for the schools, they're tremendous partners. They take this stuff very serious. We support them as they move forward with whatever their plans are. We at the county level and from an emergency management, if they need PPE, if they need those kinds of things, we're in this together with them. So, they will do their very best to make the best decision for, the group there. I know they take it super serious.
Okay. That's really all of the questions that I have. Does anybody else have anything that they'd like to touch on before we go ahead and end the live?
So, well, I would just like to say again before we close that we plan to continue doing these Facebook Lives in the weeks ahead. We'll do our best to put that message out in advance, so you'll be able to tune in if you'd like to on Facebook. And I'm going to turn it over to Matt Wallace, who's going to give us a closing statement or two. And we appreciate you tuning in today.
Awesome. And again, I do appreciate everybody tuning in today and getting the information that we've been presenting. I'd also like to thank Maria and Chief Schulmeyer, John Scott, Don Walker, and Jesse for helping set this up and get these information opportunities out to our citizens. It's been said several times that it's a protective system that we're trying to do to fight COVID. And I want to reiterate that masks alone are not the only thing that we need to do to protect ourselves from the virus. It's a system of social distancing, of washing your hands, and only interacting with a low number of people. Those 3, 4, 5 things taken in conjunction together develop a system of protection for our folks. Our job as county employees is to serve the citizens of Brevard County. Our job also is to give our citizens data so that you can make appropriate decisions for yourself and your family. That's what these interactions are about, for us to provide you information, recommendations, and the latest happenings, and give you that data so you can make those decisions. So I'd like to end with just a couple pleases here. I'd like to say, please stay vigilant out there. Please stay engaged. Please continue to have situational awareness of where you are and where your family is and what you're doing. Please be patient. Please worry about the things that you can affect. And those things that you can affect are your families and yourself and your loved ones. Be patient and take a breath, and we'll make it through this together. I have no doubt. And finally, I say, please be informed. And be informed, I say, please continue to interact with Brevard County. We have our social media presence out there on Instagram and Facebook. We're always willing to take your questions. We're also willing to do these kind of interactions more periodically as we continue to fight this thing. So please stay with us, and we'll make it through this together. Again, thank you for joining us today. We will do this again as Don Walker has promised. And again, thank you for being just fantastic citizens of Brevard County, and we look forward to seeing you out there in a very safe and sound with you and your families. Thank you again. Y'all have a great afternoon. See you soon.